I think we went into the year knowing it was the year of the nurse, thinking it was going to be a very different year.
We had seen on the news some reports of this infection.
But it just seemed that little bit far away.
Was this going to be the pandemic that would really challenge us as a community, as a health system, as infectious diseases specialists?
I was away and I got a call to say that there was a plane full of however many people coming back, and they'd all been told to go to an emergency department, which was our emergency department.
I got some phone calls saying there's people already arriving who've been on that plane who have symptoms.
We were just in a space where we got a whole lot of people in a really short period of time and really had to adapt.
And I remember the 90s nurses, it was a quote, they said, "This is what we do."
We never got that big wave back then, so we were kind of thinking, oh, we're off the hook.
It was obviously announced as a pandemic, so we knew we'd be in for the long haul.
What's coming? How do we figure out what's the worst case scenario? How do we plan for that?
We were preparing with PPE, trying to still, stockpile more PPE and get prepared in that regard as well.
At the start of that second wave, where it just felt like a siege of patients were coming.
We copped it the hardest. Melbourne, but this hospital in particular.
We realised there were actually hundreds of people affected in the towers. We were facing some of the worst things that we had planned for.
Got a call from our CEO saying that we were being asked to go into the towers and do the screening and testing.
We had a mad scramble to keep up with the changes that clinically were taking place.
We very rapidly had to deliver our healthcare. For everyone who was infected in those towers, it was an immense challenge as an organisation, and it was an immense challenge personally actually as well.
In our plan, we didn't have that we would be working in the towers, for example. We didn't have that we would be staffing residential aged care facilities.
So we had a residential care facility that clearly was not coping. We decided to open up one of our wards in Royal Park, AC4.
We had heard about healthcare worker infections happening internationally, and during the first wave, we didn't see a large number of those. And unfortunately, in the second wave, it absolutely happened for us.
I've got a daughter doing year 12, and it's been a catastrophe as far as the year goes. But it was a story that was just so familiar to everybody.
A microcosm of what we've all been through, right? Everyone's life has changed immeasurably.
But there was real sensitivity shown to, people approaching end of life. The nurse at the bedside tried to walk in the shoes of those that were going through these really challenging periods of not being able to be together.
The iPad communication tool, which was great, but obviously you were in the room holding the iPad for some very, very sick patients and potentially saying goodbye. I don't think any of us will forget.
I have always felt very in awe of the team.
I can't think of one person who didn't go above and beyond.
We cared for a substantial proportion of all COVID cases in Australia.
Theatres operated, patients were cared for in the ward, in hot and in cold.
But no one complains, everyone comes to work, and this was just another opportunity for the team to shine.
People flexed up and they surged and they went to areas that they hadn't worked in before.
I couldn't be more thankful for the colleagues that I work with.
I have never seen an organisation work so collaboratively and with a single vision like we did with this.
The executive support, the micro, the cleaners, everyone did their really great part.
I wish I knew all 10,000 plus staff could write them a personal note saying, thank you so much for all the incredible work you've done.
It's an absolutely unbelievable achievement. It's an achievement of the Victorian community who endured those restrictions, and we're seeing the result now. It's unbelievable. It makes me so proud of Victoria. It really does.